I'm Pat Barrett. Today, we're going to focus on health again, and this time with a woman who experienced an almost fatal heart attack after she had had a baby. It's postpartum condition. And my guest today is Wakisha Stewart, also called Kisha, and she has had a remarkable journey. Frankly, probably so has her family. And I have learned things that I didn't know, and I thought I was fairly well informed. So I know that this is going to be an important program, and particularly for people who are the leaders in their businesses, the leaders in their companies, the leaders in their family and extended family, etc. So as they say, listen up and let me introduce Kisha. How are you doing, Kisha?
Great, great. Thank you for having me on today.
Oh, it's our pleasure. And I am so excited to have you tell all the people in our audience, who include also some men, but we need some men advocates for sure, for sure. Um, what happened to you? How old were you? What exactly happened? And were you at all prepared for what happened?
No. So when I was 31, I in 2011, I gave birth to my second son, and 2 weeks later, I experienced something that I didn't know could happen. I had what was called a spontaneous coronary artery dissection. And what that means is an artery, a major artery in my heart actually tore. And that tear
Woo!
created yep, that tear actually created a blockage, and because of that, I had the quote unquote "widowmaker heart attack" in which only
Oh
1
my
in
goodness.
4 survives.
Oh my
But
goodness.
leading up to that, I was healthy my whole entire life. I was an athlete. I ate well, and I didn't have any family history of cardiovascular disease. And I didn't know that women could have heart attacks at that age. I didn't know women could have a heart attack
I,
after
I didn't either.
pregnancy. Yeah, so usually what's talked about is, preeclampsia, high blood pressure,
Yes, right.
which is also cardiovascular disease. Any woman who has preeclampsia or even gestational diabetes during pregnancy is more at risk for developing cardiovascular disease later in life.
Mm.
But at the time, I was a nursing assistant, so I knew what the signs and symptoms were for a heart attack,
What
but I
were the
never
signs and
suspected.
symptoms?
So the general ones that, I was trained for are, the typical male symptoms. Women have very different ones, but men typically have that sharp chest pain, the numbing and tingling of the left arm,
Mhm.
and that pain radiating and sometimes indigestion. Whereas women, it can actually seem more like flu-like symptoms. Sometimes you could be a little disoriented, extremely fatigued. You can have indigestion. You don't always necessarily have that sharp chest pain when a heart attack is happening as well. In my particular case, I was at a dinner party for the first time out in months since having, or since being pregnant, and then 2 weeks after, having my
Mhm.
son. That particular day, normal, I fed him, held him, but I was feeling extremely tired. But I kind of just figured, okay, well, I just had a baby and I'm up all hours of the night, so,
I should
not a
be
big
tired.
deal. Yeah. So we went out that evening, and during the course of the night, I started to feel even more fatigued, a little more disoriented. When I was having conversations with my friends, I couldn't really focus on what they were saying. Um, I was hot, clammy. I went to the bathroom, splashed some water on my face, thinking that would help. And when I left the bathroom and sat back down, that's when I had that intense, sharp pain in my chest, like
Uh-oh.
nothing I had ever experienced before. And mind you, I had just had a baby, just went through labor 2 weeks prior. Um, and then I had that tingling sensation down my left arm, and the pain radiated up to the back of my neck and into my jaw.
Oh,
At
good.
that point, I looked at my husband and I said, "Something is terribly wrong." I knew my body, I knew how my body reacted to things, and although this was my second child, I knew that this wasn't right. Something else was going on. I was extremely nauseous. I, started vomiting.
Oh,
We went to the ER. He drove me, which I don't recommend. Call 911 if you have any sort of symptoms.
mhm,
But again,
mhm.
at the time,
You
I
did.
didn't know that it was a heart attack that was happening to me. When we got to the ER, the receptionist, she was taking my information and she asked me, "What brings you in?" And I told her I have excruciating chest pain. I couldn't breathe. It felt like my chest was like in a vice, just being crushed.
Oh
That's the
my
feeling.
goodness.
And I told her, and she asked me, "Well, what were you doing prior?" And I told her we were at a dinner party. I just had a baby because I want to make sure that they have all the facts that they need so
Mm.
that I could get the treatment that I need. And she rolled her eyes and she told me, she said, "Oh, it's panic or an anxiety attack. You'll be fine." And I, once again, because I know my body, I told her, "No, this is not anxiety and this isn't panic." And looking back now, I think for anyone to go into the ER, there's supposed to be a standard protocol. If you say that you have chest pain, that has to be taken seriously. But unfortunately, when it comes to women, we are seen as being dramatic, especially young women, especially women who are just out of pregnancy. A lot of times we're not listened to. But that night, because I was sure of myself, I insisted that I was going to stay and I wanted to be seen. She rolled her eyes and told me to go wait in the ER waiting room. And I was still experiencing all the symptoms that
Oh
I
dear.
had. Finally, about 25 minutes or so later, I get called back. They run a bunch of tests. They do take my blood pressure, they check my temp. They did two EKGs, which both were inconclusive. And the tech and the nurse kind of looked at each other and said, "We don't know what's happening." And then a more senior nurse, my guardian angel, she walked by the bay that I was in and she looked at me for maybe 2 seconds and said, "She's having a heart attack. She needs to get to the back now." And suddenly, like that,
Whoa. I
everything
got chills.
just, I recognized, oh my gosh, yes, this is what it is. But if you would have said that earlier, I wouldn't have thought, "Oh, well," I would have just said, "Oh, I'm just tired," or maybe I ate something that didn't settle. But when you put all of those things together, then you can say, "Okay, yes, something is wrong." And now I know that women are affected differently than men are. I had to be rushed to a different hospital because the hospital that I was at didn't have a cardiac intervention unit, and it
Oh
was at
wow.
that moment that, or at that hospital, that I had a cardiologist who had a case like mine the year prior. And he had been a cardiologist for 30 years. So I was the second case of SCAD that he had ever treated. And unfortunately, many cardiologists don't see this in their office. Many cardiologists don't even know that it truly exists. Many OBGYNs don't recognize this. And
And women don't
unfortunately,
get told.
and women don't get told. In my opinion, and in my book, I talk about this extensively, but in my opinion, knowledge is power. That's how I was
I
raised.
agree.
Education is key, and your voice is your most powerful weapon. So when it comes to your life, you have to use it. When it comes to advocating for yourself, or maybe it's a family member, you have to speak up because it truly, truly is the difference between life and death. And it was in my case. If I would have listened
Absolutely.
to the receptionist, I would have gone home and I would not have
I,
woken up.
right.
I wouldn't be here before you today.
Right. Right. Well, and your husband was with you, and I bet he feels pretty strongly too.
Yes, he still, it's, um, interesting because we went out to eat last night actually, and he was telling the story of what happened to me, and he was still getting fired up about the treatment that I received, about not being believed. Um, so it's still something that resonates with my family. It's still something that we experience. My children are, all three of them are very well aware of my heart condition. They know that, sometimes mommy has to take a little more time. And they themselves, I've taught them to speak up. Speak up if something doesn't feel right. We have to start our children when they are young so that
Mhm.
they
Right. They
have,
learn to speak up.
right, so they have the confidence in themselves to be
Right.
able to speak up.
Exactly. Well, I bet that this has made lots of changes in your life, but it's so concerning because in reading some of the information before we got on, I understand that this happens way more frequently than maybe the doctor where you were had experienced. And yet, doctors don't prepare their patients. Patients aren't prepared. And probably a lot of people, and statistically, I think a lot of women are dying from this very thing and they
Yes,
have no clue. No
no
clue.
clue. Cardiovascular disease is the number one killer of new moms. Cardiovascular disease in general kills more women each year than all cancers combined. That
Wow.
that statistic is scary.
It is.
We're losing women. We're losing the people that we want, to increase the population.
Well,
We have to make change.
I hate to put the question like this, but why isn't somebody doing something about this? Now, it happens that I didn't introduce you probably because you are a national spokesperson for the American Heart Association, and I
I
can see why. But why are people not doing something about this? Why don't we know?
I really truly believe that more people like me need to use their voice. More people need to speak up and make noise. It's not enough for, the American Heart Association and Go Red for Women. Those are great organizations and they're trying their best to put forth as much information as they can, but it needs to be relatable. You need to have someone placed in front of people in which they can say, "Oh, I see myself in her. I better take care of me." You know, heart disease, there's a new face. It's no longer, Grandma Betty who smoked, cigarettes and drank wine for, 40, 50, 60
She
years,
brought
or
it on herself.
right, or Grandpa Joe who ate, steak and eggs, all of his life, who's, in their 70s, 80s, 90s. Cardiovascular disease is affecting younger women more and more, and we are losing
Oh, not
them
good.
more frequently. The type of heart attack that I had, it affects 35% of heart attacks in women between the ages of 20 to 50.
Oh,
So that's a lot.
that's
That
a
is
lot.
a lot. Yes.
That is a lot, a lot.
Yeah. And
Nobody,
more
and
research.
doctors aren't even telling us. We don't have
No,
any.
and they don't know. And I often tell people when I was working as a nurse, I tell people you have to advocate for yourself because doctors don't know everything. Sometimes you might have to bring information to them. Um, Medicine is a practice. Doctors are providing a service. You can fire your doctor if the service that you are getting isn't what you need. You have to be the captain of your healthcare team. Um, there are medical advances every single day. So one doctor cannot know everything. For me in particular, I couldn't see the doctor that saved my life. He had to place a stent in my heart to save my life
Oh,
because
wow.
of insurance issues. But uh, the physician, the cardiologist that I was assigned initially, he wasn't, how can I put this nicely? He
Oh,
and I were not on the same page as far as how I felt um, I needed to be treated. I wasn't
uh-huh.
your typical patient. You couldn't place me into, your
You were a
typical
nurse.
categories. And as a nurse, we are taught to look at every individual as that, an individual, and adjust accordingly. But he didn't want to do that. And then I finally found someone who did. I found a cardiologist, and when I did, I got out of heart failure. And when I was reevaluated, I didn't need to have an ICD, which is a device that's implanted in order to control the rhythm or
Mhm.
shock your heart in case it's
Right,
out of
right,
rhythm.
right.
Um, and all because I changed doctors and I found someone who listened to me, who said, yes, I am going to look into that. Yes, we are together in this. We are going to fix this. We are going to solve this together.
Wow, wow. Well, Keisha, I also know that you have written a book, and I really want you to share your book so that if people couldn't get all the information out of our discussion today, they'll be able to go and pick up your book. And where can they get it?
Yes, so my book is called Sonata for a Damaged Heart, and it discusses everything from the day of my heart attack all the way through all the ups and downs, even having another pregnancy, medical insurance issues, all sorts of things, all the way through the Lahaina wildfires, because that's where I live right now.
Mhm.
Uh, and it's available on Amazon. You can also go to my website, which is KishaNSCAD.com, and you can find it there as well.
Very good, very good. Well, did you indeed have like a near death experience? Is there anything else like that you'd like to share with the audience?
Yes, so during when they were first working on me, I had an out of body experience. And I was kind of at that I had that mentality that, okay, well, I'm having a heart attack and it's taken so long because time is of the essence.
Yes, it is.
Everyone should know that. Heart attack and stroke, time is not on your side. So you have to act immediately.
That's
And
right.
by that point, it had already been approximately an hour or so since had the first symptom that I could place. And at one point, I kind of was resigned to the fact that I was going to die. And I could see myself in the hospital bed while they were doing my IVs and giving me oxygen and morphine. And I could see myself speaking with my husband and asking him, because I had another son from a previous marriage. And I said, please make sure that the boys know how much I loved them. Please make sure that my infant son knew how much I really wanted them. And please make sure that they grow up together because I'm not going to make it out of this. And of course, he didn't want to hear any of that. But I saw myself saying this and I felt myself leaving. But
Mm.
for whatever reason, there was something in me that made me stay. And I survived for a reason. And I think this is the reason to bring awareness, to educate, to make
I
sure
think you're
that,
right.
right. And one of the reasons why I wrote the book is because I want people to understand truly what is happening, in our medical system, what is happening to women. And I don't want another woman to feel as isolated and alone as I did when I went through it.
Thank you, Keisha.
Thank you.
And I hope that your story will influence a lot of people.
Thank you.
And then what the other thing that we talked about, which I'd like you just maybe to touch on briefly, is part of the reason that we don't know is because there's so little research devoted to women's issues. And
Yes.
I don't think that either, well, I have opinions, and I'll get to
We can
air
have
some
a
of my
whole other
opinions.
we can have a whole other segment on that.
But I think that people need to know that part of the issue is the lack of money going to research for women. That's one. And I think that the other part is that our medical facilities that teach doctors are not doing their job to make a point of teaching doctors what we need to know. If you're gonna treat women, you should know something, and especially when the stats are this big.
Yes. Unfortunately, like you said, medical research throughout the 1900s, was more applicable to men. They had men in these research studies, and they thought that, okay, well, this was the research that we did. It should be applicable to women as well. Well, we are biologically very different and we are affected very differently. Even when you look at the differences in signs and symptoms of heart attacks very different. So we need more research trials that include women and include women of all races. We need more money put forth to these types of research studies so that way we can start developing and really understanding why things are happening. My whole life, I've always been the type of person to want to understand why. Why did this happen?
Right, me
And
too.
I just think more backing so that way we can save lives, our mothers, our cousins, our aunts prematurely. We deserve to have.
I want to thank you so much for being my guest today. We certainly will carry a lot of this information uh, on the page so that people can find the book and can also um, tell you how much they appreciate getting this information and what they're going to maybe what they plan to do with it. And I hope it's to share it with the people in their lives so
To
that
be
we can.
able to live. And the more we understand that, the more money that, yes, I implore everyone to take control of their health and to have others tell other people that they need to take control of their health because it can happen to you. It can happen to anyone. No one is immune. No one.
Thanks, Kisha. I really appreciate your being my guest, and you'll have to come back. We'll have to do this again. Maybe we'll take another aspect of it and really maybe have someone that is involved in research or whatever, so that people can really take this a lot more seriously. Yeah, once is definitely not enough. So thank you for all you're doing. Thank you for speaking up. Thank you for teaching others how to speak up. Really appreciate your coming.
Well, thank you for having me. I enjoyed it and I look forward to having another discussion.
Good. I do too. Thanks a bunch.